all for coming here today. As members of the medical imaging department, you know that we're always trying to expand our services and increase our patient care. Within the next month, we're going to begin doing contrast-enhanced echocardiograms. To get to this point, we've done some training. Ariel went to Strong, and Strong has come here to train her. Mona and I went to Strong, and Kim went to the cardiologist office here in Wellsville. I've put together policies and procedures and have developed a consent form and a post-monitoring form along the way. I believe that it's important to offer our exams or our patients the best exams possible, so that's why we're going to start doing these. We'll start by explaining what the echo contrast is. In the department, we use many contrast agents, and this one is also injected through an IV. It contains microspheres, or bubbles, that you can see pass through the heart. When they go through the heart, it creates an echogenic contrast effect that you can see on the images. What happens is Ariel's going to decide that the patient's going to need contrast. Kim will do the injection. As the injection is taking place, it's kind of real-time instant. Kim injects, Ariel sees it on the pictures, and then they're done. When you're done, this is not filtered out through your kidneys. You actually breathe it out on your expiration. So as you breathe out, the microbubbles are leaving your body, and the whole process takes no more than 10 minutes. On the next slide, you'll see a picture. The heart on the left has the contrast in it. The heart on the right doesn't. So you can see how the left-hand side of the heart, you can delineate the left ventricle much better. So for the patients that are suboptimal, it'll make a big difference. There's two kind of contrast agents that we'll use. We're going to use Optisane and Definity. The reason to keep both contrast agents in the department is that Optisane has albumin in it, and albumin is a blood-based product. So if some of our patients come in and for religious reasons they won't take blood, they would never use Optisane. So we'll carry both Optisane and Definity. With the Optisane, it's manufactured by GE. It's stored in the refrigerator. And to use these injections, you have to activate them. This one is activated by rolling it in the palms of your hands. It's going to change the contrast agent from a clear color to a milky color, and that's how we know that it can be used. For Optisane, if you don't use it within the first minute of the activation, you're going to have to re-roll it between the palms of your hands, reactivate it, and then you'll be able to use it on the patient. And again, it's important to remember that Optisane has the albumin in it. If we look at the Definity, Definity is manufactured by Lantheus Medical Imaging. It's also stored in the refrigerator, but this is activated in a different way. This is activated by putting the vial into a little mixer, like a shaking, and it's called the Biomix. So you put it in there, and it shakes it for 45 seconds, kind of like a paint can shakes it. It's quite aggressive. And it's going to activate the bubbles, and then you'll be ready to use it. Again, you're going to look for the change in color from that clear color to the milky color. If you don't get that milky color, then you're not able to use the injection on that contrast or the injection on the patient. This one lasts for 5 minutes once it's been activated, so you have a little bit of a longer time frame. And again, if you don't use it in 5 minutes, roll it in the palms of your hands, turn it that milky white color again, and then you can inject it into the patient. The indications that we're going to have to be able to give our patients the contrast are a suboptimal exam. So Ariel puts the patient on the table, she can't see the heart very well, and then she'll decide right then that these patients are going to get the contrast injection. If she can't see the left ventricular border very well, she will also give them the contrast. And then patients that would come to us for assessment of a cardiac mass, or she even stated that sometimes you can get a blood clot in the left ventricle, that you would give them the injection. The way that I'm going to set this up is that she will have standing orders and will be able to make the decision on which patients are going to get the contrast and what patients are not going to get the contrast. There are basically these three criteria and a little bit more. As long as they meet those criteria, she will be able to give them the injection. We'll change the requisition. The requisition will read echocardiogram with contrast if indicated. So that way she's not going to have to stop, make all the phone calls, get the new requisition while the patient's already on the table. As long as she follows the indications and we have the policy in place, she'll be fine. If we look at the contraindications for Optisyn only are patients that have a known or suspected hypersensitivity to blood or blood products or the albumin. They would not receive Optisyn. It would only have the option of Definity. Any patient that has a known right to left, bidirectional, a transient right to left cardiac shunt can't receive either one of the contrasts. And all patients that have a hypersensitivity to perflutrin can't receive either one either. Perflutrin is what is actually the microbubble in the contrast agent. So another thing to remember is that all injections are to be done through your vein and not intra-arterial. If we run through it real quick, the way that it's going to work in the department is Ariella will bring her patient into the room, set the transducer on the patient, take her images. She'll know within the first 5 minutes whether these patients are going to need contrast or not. She'll notify Kim, consent will be obtained, and the injection will be done, and then the exam is completed. There are a small group of patients that we're going to have to keep for post-injection assessment if they have significant hypertension or what they've deemed is an unstable cardiac condition. That's our inpatients that come to us for the heart monitors and our ICU patients that have heart monitors. They have to have their blood pressure checked for half an hour post-injection. That way they can make sure that their blood pressure is not decreasing or increasing. Once it's stable for 30 minutes, they're fine to go. There's always side effects. Anytime you give an injection, there's going to be a side effect. The known side effects for both of these products are nausea, vomiting, headache, flushing, hives, itchy skin, dizziness, and back pain. The back pain is known more with Definity than it is with Optisyn. So if you have a patient that you feel is extra sensitive, might have a lot of allergies, the fair red-headed patients, you would want to give them the Optisyn. They're the patients that are more prone to having the back pain. When we went to Strong, they told us that when you see a patient that has the back pain, it's the worst thing that you've ever seen. The pain is not tolerable, but it only lasts for about 10 minutes. They also stated that the pain kind of almost decreases in severity with every minute, so that 10 is a 10, and then as they go down to the 9-minute, the 8-minute, their pain decreases. They don't know why it happens, but they also said that when it does happen, they'll put the transducer on the spot of the back pain, and the sound waves seem to help alleviate the pain a little bit quicker. So you can also see that I did not mention death. There have been no specific deaths related to these injections. There have been patients that have passed away after they've gotten the injection, but they feel that it's their medical conditions that caused them to pass away, not necessarily the injection. So we've covered a lot of information. I've given you an overview of the way that it's going to work. I know that every time we start something new in the department, there's bumps in the road. But I've seen us all work together, readjust our bumps in the road, and then continue on. I believe it's important for our patient care that we go ahead and do this. I know that as a team we pull together, we get through it just fine.
Good question.
Okay.
The rolling of it,
Yes.
how does it go from that to patient?
Once
So
you
those
activate it,
contrast is rolled?
enroll it in the syringe, and it stays
Oh,
the
in
milk.
syringe.
But you're gonna activate it in the vial. Then you're gonna pull it out, put it into a syringe with saline. That is the nursing experience that we don't have to worry about. As long as we see that it changes from clear to white and we know that it's activated, we can give it to the patients. It can stay in the fridge that we have the drinks for sitting in because those are patient related. It cannot go in your fridge. The nurse has to do it because we're going to monitor their blood pressure. So we're not capable of monitoring their blood pressure, and it's a little bit more than a standby. So no, I would not, as a certified person that can give an IV, give this product. We're